Hi again, Dr. Sarhadi here with Nancy. Nancy also has grinding at night. She has a really strong masseter muscle and she grinds her teeth and she has kind of pain up in her TMJ. So one way to treat this is with Botox, and it's the same technique that you use to slim a wide face for patients who have most masseter hypertrophy, so that in patients where that muscle is a little bit big. So we're gonna treat her with Botox down into the muscle, and within about a week or so, she should start to feel some improvement up in this joint here. Here we go. How's that, Mommy?
Fine. Very easy.